So you take your temporary and you would go back in the room and put it in the patient's mouth to make sure it fits. And as you can see, there's a nice, how you can tell if your margin is nice if you take a sharp instrument and just kind of, you can see the margin and the edge of the crown meet beautifully. So there's nothing that's going to get trapped in there. There's no cold air or anything that's going to get in there. It has a good solid fit. And this is, you can't see this in the patient's mouth unless you have a mirror, but I'm going to turn it around so you can see the other side. Same thing, nice smooth margins in there. And like I said, on these models, it's hard to get a good contact because this is rubber, but if this was in the patient's mouth, there would be a really good solid contact in there. You would run floss in there. If you feel that snap, that's how you know that that contact is there. So once you have the temporary in, you do want to make sure that it's not too high. You want to make sure that they're not hitting it too hard. So you take some articulating paper, a little tip or a little trick we use with the articulating paper, we put a little Vaseline on that. It actually helps it mark a little better, more clear. So then you would put that in the patient's mouth and you have the patient tap, 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 tap. See? And there's a little high spot there. So then you would take that out and go back and adjust that high spot. You can use this wheel and just go back and adjust that little high spot there. And then you go back and try it in again, and if you see it's still high, you can adjust a little bit more. Or you can go ahead and cement the temporary and just have the doctor adjust it inside the patient's mouth. But sometimes I like to just have it done so we don't have to run back and get the doctor. So it's always nice to be able to do it so that patient doesn't have to wait and you can get them out of there. And so then you have a nice occlusion on that, and that pretty much is it on making a temporary. After you make sure that your height is your occlusion is good and your contacts are good, you can go ahead and cement the temporary. Basically, when you do load the temporary with temporary cement, you don't want to put an excessive amount in there. You basically want to mix it, and you just want to line the inside of it. The fit is pretty tight, so you don't need a whole lot in there. You just want to cover the whole inside of it, and then you put the temp in there. You're going to either use finger pressure, or you can put a cotton roll in there and have the patient bite on it. And after the cement sets, you just go in there and you make sure that you clean around that margin there. You want to clean there, and then you would put floss in there and make sure you floss it and pull that floss through. Do not come up and down on that. Go down and pull it through. And that is how you make a single temporary or fabricated temporary for a patient.